patient's or your client's behavior before we can even start assessing them. Okay, not labeling, but getting to the point where you know what might come out of their mouth or what their pattern of thinking is. Okay. So everyone has a piece of paper, has a pencil ready. Okay, so I'm going to ask you to draw something, and it is not going to be very artistic. All you have to do is follow my instructions. Okay, ready? Chat box, ready? Okay, I'm going to give you 5 minutes to draw it. On the sheet of paper that everyone has, I would like you to draw a pig. P-I-G, pig. I'm going to give you 5 minutes and your time starts now. It's 15:37. I'll give you 5 minutes. Anywhere on the paper, just draw a pig and make it as detailed as you want. If anyone has a doubt what to draw, I wrote in the chat box. You have to draw a pig. 1, not a lot. And let me know, please, when you're done. But I'm still going to give 5 minutes. Till 3:40, 3:41. Subrita, you have a piece of paper and a pen. You have to draw a pig. Yes. Make it as detailed as you want or as simple as you want, but anywhere on the paper, one pig. Okay, 1 minute left. Are you guys done? I drew my pig. I'm going to wait for Subrita to finish and then we'll do the analysis. Okay, is anybody left for the pig? Okay, cool. So I hope all 23 participants are done with the pig. And what I'm going to tell you now is a very fun personality assessment. For people who have their camera on, can you show me your paper? Okay, that's a cute one. Okay. Great. Kanika, can you show me yours again? Okay. Archana. Your pigs are really detailed. Do you want to see mine? This is my pig. Okay, let's do the analysis now. So, everybody has their pig ready. I'm going to read out things and you have to tell me whether this analysis, what do you think about this analysis? Okay, this is not a scientific instrument, this is just fun, but it can say a lot about your personality. So, if your pig is towards the top of the paper, if your pig is towards the top of the paper, you have a tendency to be positive and optimistic. If your pig is towards the middle of the paper, you have a tendency to be a realist. And again, if it is towards the bottom part, you have a tendency to be pessimistic and may be prone to behaving negatively. Okay? Then, if your pig is facing left, you have a tendency to believe in tradition and be friendly. But you may have a very sharp memory and you may be prone to remembering dates very well. If your pig is facing right, you have a tendency to be innovative and active and creative, but you might have a tiny bit bad memory and may not have a very strong sense of family. If your pig is facing front, like mine, you have a tendency to be direct and may enjoy, making people fight by evocating both sides of the coin. You may enjoy playing the devil's advocate. And you're prone to neither fearing nor avoiding confrontational discussions. So you like to discuss and you don't run away from any kind of discussions. Okay, people who have pigs with hair sticking out. Okay, that means with a lot of details. You have a tendency to be analytical, but may also be cautious to the point that you struggle with trust. So you might have trust issues and you are very analytical if your pig is very detailed. And if your pig has very few details, you might be an emotional thinker and you might focus on larger picture rather than focusing on details. And you might also be prone to take great risks, and sometimes you can be reckless and make impulsive decisions. Okay, anybody has a long tail in their pig? A person who has made a long tail with their pig, it indicates how intelligent you are. So if your pig's tail is longer, the more intelligent person you are. I do not wet this, but I always enjoy looking at my pig's tail. So apparently my pig has no tail, so you can judge where my intelligence is. Okay, back to chat. What do you think? Why, Archana? Okay. Okay, repeat about the top. So top is you are an optimistic person. You have a tendency to be very positive and very optimistic. Pigs have short tail, yes, but it's a pig and you're pig and you can do anything with it. Yeah, I like curly tails too. Okay, so what did we do about this? Yes, please. I would love to see everyone's pigs and where it falls on the paper. That will also tell. I think the most part that works for me is where the pig falls on the paper. The top part, the middle part, or the bottom part. I don't care about the pig's tail, but that part also. Oh, you made a colorful pig, Parul. That's really cool. Okay, anybody else? Vinita. Is that a mouse or a pig? Okay. I think it's really at the top of the paper. Very good. Archana, I see your pig. Okay, who else? Dr. Shamadev, I see your pic. It's very detailed, isn't it? Who else? Subarita ma'am. Oh, nice pig. I like that curly tail. Fatima, your pig is just like mine, but it's more detailed in your face. Marina, fantastic pig. Oh, I have something about the legs too. Give me a second. I'll find the legs. So if your pig has 4 legs showing, you have a tendency to be secure and you stick to your ideals. However, you may feel that others are very stubborn. But if your pig has less than 4 legs showing, it may indicate that you're living through a major period of change, and as a result, you may be prone to struggling with insecurities. So legs usually denote securities. If you have 4 legs, you're very secure. If you have less than 4 legs, might be going through a period of change. Fantastic. Okay. Anybody else wants to say something about this before I move on? Prerna, what did you say yes for? Your was top left. Okay. And you are an optimist person? Okay. So why did we do this exercise? What exactly is the purpose of this exercise? Can anybody think about that? If Shikha, why? Okay, a pig is a pig, no matter what it looks like. Okay, to understand mental orientation, yes, and a personality assessment, yes. But why would I want to do a personality assessment for any kind of psychotherapy? How will a personality assessment help me in any kind of psychotherapy or counseling or anything? Spontaneity, yes. To check basic response, yes. To know a person a little deeper, that's right. To know where to start in counseling, absolutely. And for example, if I am talking to a person about relationships who's a very logical thinker, cutthroat, steel, very sharp steel thinker, it might be very difficult for me to make them understand how relationships are based on emotions. It might be very difficult for them to elicit emotions from them inside to work on their relationships. Okay, so no matter how much goal setting I do, no matter how much perfect treatment or management I teach them, if their anxiety is about their relationships and they are a very logical thinker, uh, they are low on emotional capacity, it will be very difficult for them to understand it. I'm not saying impossible, but unless and until they know that they are not something that are very emotional right now, that they're not something where they think in emotions and they think in logics, it will be a point for a counselor or a psychologist to make them understand that first about their basic personality. And then you can take it from there. Okay. Another example I'll give you. So if you have a client who's very low on creativity, okay, it will be guided imagery will be very difficult for them. They will not want to close their eyes and walk in the garden at all. So that kind of treatment will not work with them. If you have a client who's very neurotic, very pessimistic, deep relaxation therapy might not work with them at the start. Okay, for them you will have to do a certain different kind of things. For example, for exposure therapy, you will need optimists and you will need realists. Exposure therapy works a little differently on pessimists. For pessimists, you have to first make them see that this is a part of their personality and that they can change it. before getting to any kind of therapy. Okay, anybody has questions on personality first? I'd like to take that first before we go into CBT. Anybody wants to talk about any changes that they have tried to bring about in themselves and have failed? That can be a good starting point. For example, okay, let me talk about myself. The change that I really want to bring about is sleep more. I sleep for about average of 4.5 to 5 hours every night. And when I try to sleep more, my entire body aches and I get very anxious. Okay, so the reason why, how this equates with my personality is, I have a personality when I'm anxious, I get so hypercharged that I have to do everything in the house, that I have to finish all my chores, and only then my anxiety levels come down. So when around 4 o'clock when I wake up, I have to do something. So when I wake up, so the way I work around is, if I am awake at 4 o'clock, I wake up, I warm a little bit of water, I drink it, then roam around the house, we take 2 rounds, and then get to bed and then sleep again. And then I sleep for another 2 or 3 hours. But that is how I am able to get more sleep. That is how I'm able to work with my personality rather than working against it. So you see, this is how knowing how your personality is helping you manage any symptoms, any client symptoms, any anxiety symptoms, any anger symptoms, anything else. Okay, anybody wants to talk about something they want to change and what their personality might be? This works a lot with people who are struggling with their relationships, and then you have to try to find out whether they are a very logical thinker or a very emotional thinker. This also works with clients who want to climb the corporate ladder, who want promotions, and they come to you and they tell you that they are working really hard, but they're not getting more salary or promotions or recognition at work. So you find out what their personality is. Is it a kind of logical thinking personality? Do they have leadership skills? Do they have need for control? What is their personality? Are they a taskmaster? Are they a relationship master? And then you can help them work with it rather than working against it. Okay, so everybody has their pigs. I can send analysis chart later with Dr. Mittal, and he can share with everyone, and you can have your pigs and your analysis with you. Okay, so before we go ahead, I would like to ask you if anybody has any questions on CBT sessions that we have done, the 5 CBT sessions, 2 about the general CBT and 3 specialized CBT on anxiety, on anger, OCD, depression. Any questions about that? Or if you've seen any client and you have any questions on how CBT can help them, or if you have any questions about your quirks and how CBT can help you. Okay, Pavana, I'm going to unmute you. Yes, please.
Hello. Yes, good evening, madam. Madam, I have one of the client who is around some 30-year-old, and she was a working professional who, due to some family constraint, have stopped working as of now. But she has come for an CBT for depressive episode. So a daughter is autistic, so family burden not that good about family support, husband and wife does not get along. So this is her whatever the background. The thing is, she does her household chores, but she has this anhedonia, not interested in doing any work, not motivated enough to do things. And she also compares between whatever her previous past, whatever her herself, whatever she was, in the past. Now she always compares it to her present, where she feels that no, this is not enough, whatever she's doing. So these kind of a patient, what she does is, see, this is almost a third session which I took. So when I started with telling her how these things go on CBT and what is her reciprocation, what is that she is to do, she doesn't maintain a mood chart or, how whatever the triggers, a thought, or, she does not, whenever you tell her certain things to be done, as we give in an assignment. So she just comes back with the same problems, and she speaks about regarding the same issues all over again. So how do you go about with these kind of patients who are a little bit guarded about whatever things are? One thing, and then who do not have not fixed enough to do the assignments part. So how do we?
So as I get from you, that client has had a depressive episode, or is she in depression?
Yes.
How long is the depression?
So depression is, she's already on antidepressants currently, because previously when she had taken, she was refusing for the treatment and all those things. So currently almost about some 2 to 3 months she is on antidepressant. And regarding whatever the functionality is there, she is improved with whatever the cognitive self is there. So there isn't much of an improvement, whatever the depressive episode, like suicidal thoughts she has and all those things she had. But now she doesn't report of any suicidal thoughts, but able to maintain her household chores and all those things. But to continue with her improving her functioning, so I thought probably she would get into CBT, but she's not that motivated, or that still that kind of this is there that where she all over ruminates about the same problems. So how do we get better out with it?
From what I think, I don't think she's ready to do any kind of exercise right now. From what you're telling me right now.
Yes.
Okay. And that can also be, okay, you are aware of what psychotherapeutic drugs she's on, right? You don't have to tell me here. But are you aware?
Yes, yes. Okay. Yeah, I'm the treating doctor.
Are you aware? I'm sorry?
Yeah. I'm the treating doctor for her. Yeah.
Okay, great. So a lot of times when a client isn't doing their homework, that should be an indication that they are not motivated to change. Okay? And when they're not motivated to change, that means no matter how much you motivate them, or no matter how many reasons you give them, they will not change unless and until they find their own reasons. So the way to go about this is empathy. Just giving them empathy and letting them vent till the time she's ready to vent. Okay? Maybe there is some emotion that she is not able to put into words. So what you do is you paraphrase her statements. Is that what you're saying? Is that what you're saying? Is that what you mean? Do you think this might be because of this thing that happened at this point of time? What do you think about that? Okay, so homeworks will not work for this client at all.
Yes.
Not at all. Especially with depressed clients, for clients who had a depressive episode and who have recovered slightly from them. I have my personal experiences, nobody does homework. Okay. Simply because the amount of energy that they have left after doing their chores, after finishing what is required of them, they cannot devote it to themselves.
Okay.
So ask her what in her past, she goes back to the past, right?
Yes.
Ask her what did she like doing there. And if self-care is something that works with most of the women, so ask her if she liked doing self-care, painting her nails, or cutting her hair short, or doing something with her wardrobe, or whatever is it that she used to do in self-care. Ask her to do that.
Okay.
Once a week. Whatever she liked doing earlier. If she wanted to paint, if she did gardening, just one activity in the entire week or between 2 sessions. That is it. No homework. She might not be ready to do any homework.
Okay.
And if the client is not ready to do homework, if they come and went to you the same things again and again, let them. You might be the only safe space that they have.
So that does not create any kind of a transparency, that I would not over time feel that this is not happening, or this patient is not getting better anymore with or anything like that. Is there any possibilities of like that?
It is not your job to make them better. Your job is to be non-judgmental, empathic, and provide a safe space to vent their emotions. That's all.
Yes. Yeah.
If they display any tendencies, if they ask you, Pavna, how can I be better? That is when you give them homework. Okay. Or you ask them, would you want to do this? Would you want to show me the colors of your nail paints when we meet next time? If they say no, let it go. You're the only safe space that they have. And that is it. That is nothing else is required of you. This is something, we have been conditioned as a child that we have to show results, that we have to, there has to be a report card for us. For everybody who is in this room right now, tell me if you have not been conditioned that way.
Yes.
We have to show some kind of achievement, right? But this is not how mental space works. All you have to be there for your client is just as a non-judgmental friend. That is your job. That is what we are being paid for. That's all. You don't have to show any achievements there. Okay?
Yes. Done, madam. Thank you. Yeah.
I hope I answered your question.
Yes, absolutely.
Okay. Subhita ma'am.
Yeah, good evening, ma'am. Ma'am, I'm not ma'am. Please don't call me ma'am. Ma'am, just the thing I written in the chat also, psychometric test.
Okay. So psychometric test is a complete semester.
Oh, okay. So
okay, it's a complete semester. Yeah, it might be difficult, but let's talk to Dr. Mittal about that.
Yeah, please do that, because I think this is this is very important for the personality assessment for any client.
See, personality tests, they shorten a psychologist's work.
Yeah.
Okay, but they do not overtake it. So if you have to take 3 sessions to get to know your client, you will have to take 3 sessions.
Okay.
But what happens is, if I map my client's need for control, and then they keep on telling me that they keep on having fight with their mother-in-law over something very trivial,
yes,
I will know that this is because my client has a high need for control, and that is why when mother-in-law tries to take control of the household, this is when she gets annoyed. And that is what I have to tell her, that you have a very high need for control, and when you get annoyed, this is what is playing. So if you think you can let that incident go, just let that incident go with using these techniques. Okay. If you are not very well versed with psychometric tests, that is also okay, because there is a negative side to psychometric tests, that they label a person. So if you tell me, Rati, I have a client and she's depressed, you already stuck a label there, right? A depressed label. So even if I want to approach that client in a different way, I will always have this playing in my mind that this client is depressed. So that is one negative thing about psychometric tests too, that they stick labels. So if I have, this is the both sides of the point about psychometric tests.
Got it, ma'am. But I mean, if it can be accommodated, if you can teach later or someone else can
We'll
teach.
think about that.
Okay, ma'am. And ma'am, one more question. There's a client who doesn't want to open up. He wants counseling, but he doesn't want to talk about one aspect, which is it's a kind of a marital counseling, and the husband doesn't want to talk about his family.
Okay.
And that is the main reason of their fight. But he's like, I am ready for counseling, but I will not talk about my family. So is there any kind of written CB kind of a thing wherein I can make him speak about his family?
So what is it that he wants to talk about?
No, he's like, we can talk about husband and wife issue, but my family should not come. I will not talk about them.
Or he doesn't want to go back to his family.
Yeah, his family.
Okay, but he can talk about he
But
wants
the
to talk about,
issue is only his family only. The issue is his family only.
no, I don't get your
The
question.
problem is his side of family only. The
So his
guy's
dad's,
side,
his parents.
his parents and sister, yeah, mother
Okay.
and sister. And he said, I will not talk about my mother and sister. I can talk about me and my wife, but I will never talk about them. And the wife has only problem with mother and sister only.
Okay.
She doesn't have any problem with the husband.
So if the wife has problem with husband's mother and sister,
Yes.
can the husband take cognizance of the wife's problems and try to fix them in case he doesn't want to talk about them? Is he ready to do that?
He's like, I will not talk about them with neither with you, neither with my wife.
Okay, that's okay. You don't have to talk about them. But
Okay.
if she has a problem with
Yeah.
the wife, with the mother and the sister, can he do something to
Yes, I got it. I told him that whatever she wants, if something is annoying her, that you need to look after, right? I mean, that you need to manage.
Yeah, so if he doesn't want therapy, okay, then that means he just wants some behavioral changes in either the wife or some intervention about what he can do to make the wife better in case they are both coming for marital counseling. So you can, instead of going into this past and trying to work the entire cogwheel, you can just tell him, okay, do this, and maybe the situation might be better. Or you suggest to me, what can you do to make your wife's concerns better? That's all. Again, for marital counseling, you don't have to treat anything. You don't have to manage anything. You just have to provide a safe space where a husband and wife can talk. So if he doesn't want to talk about his side of family, that's fine too. Just tell me here, what can you do for your wife, and is the wife okay for that? It's like a negotiation that you have to maintain.
Okay. Okay. Thank you.
Okay. Prerna.
Good afternoon, ma'am.
Hi.
Ma'am, there's a girl who's about 38 to 39 years of age, and she's trying to lose weight. She has enlarged hips, she's trying to lose weight since 6-7 months. She's been working out like for 2 hours, going for gym also and doing yoga also, but nothing is happening. And when I was speaking to her, though, I came to know more, maybe it's hereditary also. It is one of the reasons, because her family side, they all have that kind of hips and all, but more, I think it's more of emotional, related to emotions. So how can I just find out that what can be done? Because she's working out very hard. 2 to 3 hours she's been working out, and she's not eating so much. She's left dinner. She doesn't have chapati. She just takes like one chapati in the whole day. So she's not eating also a lot.
Okay. So for these clients, if there is no weight change, first you have to get them on a health tracker. Health tracker, you know that app, right? MyFitnessPal, Health,
Okay.
whatever that app is, I can't even right now. Healthify app, right?
Okay.
Where they have calorie counting happening somewhere. So ask her to input her diet. What is she eating? See, for diet, it's a vast network of information that you will have to pull from as a psychologist. And as a psychologist, if you're dealing with clients who want to lose weight, I would really want you to do a course in basic nutrition. Okay, that will really help you.
Okay.
If you're dealing with the clients with eating disorders. So for your client, get her started on a fitness tracker first, the MyFitnessPal or Healthify app, where she's tracking whatever she's eating. Okay, then she's also putting in her workouts there. The third thing that you have to come to is find out what triggers that she has to make her eat. Okay, find out when she's eating. Exact time she has to log. what are the timings that she is eating. Forget about what is she eating, because she's already logging it to the Healthy Pie app, but at the times that she is eating. So when you're identifying triggers, what was it that preceded that trigger? What was the conversation that preceded the trigger? What was the thought that preceded that trigger where she ate? And when you have the thought, that is when you start working on the behavior. So remember that cognitive triad. You have a thought, it will trigger a behavior, which is eating. Okay, and there will be some emotion attached. For the people who are not able to lose weight, they cannot identify what is that emotion. So when you have a thought, you have to label that emotion. For example, I had a fight with my mom, and I am going out of the house and she did not give me food and I am very hungry. I can make healthy food choice, right? But I go to McDonald's and I take a large burger and a Coke with it and some fries with it. So what is that emotion that I am feeling right now? I am angry at my mom. And when you, as a client, as a counselor, you identify that emotion, that is when you can teach your client to manage those emotions without food. Tell them to manage their celebrations without food. Anything that they achieve, it should not be rewarded with food. We are not dogs. None of our achievement, none of our kids' achievements have to be awarded with food. Stop that association of feeling happy with food. Okay? And if she's not eating much, remember the fuel for the brain is carbohydrates. And carbohydrates are the major sources of carbohydrates in our diet is chapati and rice. And if you are stopping that in your diet, your brain will be devoid of carbs, major sources of carbs. And that is when you will start feeling low. And that is when you will start feeling depressed. And that is when you will have mood swings. And that is when you will be more irritable, lash out, be angry. And then because you're angry and you want to feel happy, you will revert to food.
Ma'am, one more thing I wanted to share that, I found out that it's related to some kind of emotion that, she is her life is settled. She's happy with her husband. Her kids are grown up. Now she doesn't have anything to do. When I was talking to her, I found out that, I think she doesn't have anything left now to do. She doesn't have any kind of responsibility as such. She wants to work, but because of some issues at home, she's not able to work. So I just asked her that, there must be something in your life you wanted to do. So she just came up with I wanted to be a good speaker, but I was not able to do. So I just suggested her that, why not start with the audio clips and, share it with your friends and everyone. And maybe then later on you can do those positive TED Talks types video also. So is it a right approach or
Absolutely. And there is so much on social media these days. So even if you don't want to go big, just go to your Instagram account and start posting some things.
Yes, I told her the same. Yes. So am I going?
Absolutely. I am very proud of how you're going about this.
Okay,
this is the way to go. See, you as a counselor, you just have to show avenues. You have to take from one client things that they are doing, and you have to share the best practices. So you are the, I always think of myself as a train station where everyone is coming and going. They are taking something from me. They are giving me something, and I am there, constant, stable, and they find comfort that even if they don't want to do anything, they just come and sleep and rest and then go away. Or if they want to go somewhere, I am there to facilitate them. So this is the exact kind of counseling. This is the exact kind of managing their emotions or managing their therapy that we should be doing. And when your client is ready to. So good job identifying the needs of your client and guiding them in a perfect way.
Thank you, ma'am. But I hope she does that. I was convincing her yesterday. I met her, and this was just around 20 minutes. We had a talk, and I just came to the conclusion that that you are not doing anything. That is your problem, and maybe because that's a guilt factor you have in life, and maybe if you start doing something, so you can get into shape. Maybe.
Absolutely. So for everyone, work with your clients, ask them what is that they are looking for or they want to do, and give them avenues on what they can do. Your job is as a psychologist, as a counselor, as a school counselor, as all sorts of counselors. Okay, no more hands. I'm going to take chat. Yes, nutrition and dietetics course is available with NHCA, and it will be really good for all kind of psychologists and counselors to do a course in dietetics if you have clients with eating disorders. Okay, so if nobody has any questions, I'd like to share something. Okay, we have a short quiz. Chat, answers in chats, please. What is the goal of cognitive behavior therapy? Is it to vent? Is it to control people's thoughts? To change behaviors to fit one's thoughts? Or change your thought to lead to healthier behaviors and more stable emotions and physiological states? Chat, chat, chat. 4. Yes. Okay. Anybody has any other answer except 4? And I have this quiz, but we can discuss about every single question that we have. No, not 4 and 1. Behavior. When you talk about therapy, therapy is always the client working with the therapist towards something. Okay. So venting is not a form of therapy. Venting is just letting out. But if it is a directed venting, that is when therapy starts. Okay, so if you say 3, to change behaviors to fit one's thoughts. If I have a very depressing thought and I fit my behavior to change, if I change my behavior to fit my depressive thought, would that work? Not really, right? So what we want our client is to go towards a healthier environment and a healthier physiological state and a healthier thought. Behavior, emotions and thoughts is 3 things. We want them to be in a positive spectrum or in a healthier spectrum. Okay. Next. Where do our thoughts stem from? Prior experiences and previously established attitudes and beliefs, our brain, aliens, or our feelings? Okay, cool. One. Absolutely. Anybody has any aliens getting thoughts to them? I really like this aliens one. This is my kid suggested. Mommy, write aliens. Okay. What is one way to treat cognitive distortions in children? Do we punish our child and demonstrate negative consequences? Do we ignore them and they go away on their own? Or do we let them talk to their friends? Or turning shoulds into coulds? Okay, everybody says 4. Can anyone tell me why 4 and how 4? How will we turn anybody's shoulds? So again, when my kid has a cognitive distortion, I should be doing this. That is a cognitive distortion. Whenever somebody keeps on saying the should word, remember this might be a cognitive distortion in play. Okay, and the way we change shoulds into coulds is how. Okay, somebody said, Niveda says should makes a lot of, yes. Should makes a lot of control statements. When you're saying could, you are suggesting. Importance of should can be narrated to could to will behavior and validation to will belief. Absolutely, Bharat. Should becomes a mandatory thing. Very true. Should becomes like a control. Like you should be following a red light and stopping. That's a control. So how do I change my should into a could? How do I change my child's should into a could? Okay. So if my child says, I should be studying right now, but I'm very anxious. How can I change it into a could? Oh, yes, offering them choices. Very true. How should I, in this example, how do I turn my should into a could? I should be studying, but I'm very anxious that when I look at the paper, I can't even see it. How do I turn my should into a could? Okay, you could study later and do something that you like right now. Okay, so when you offer these choices, these are very ambiguous choices. Okay, sometimes we don't have time to get into the whys and the whats. Sometimes I know my child has not studied the entire year, and this is the exam time, and he would be anxious. Okay, but at that point of time, that lecturing will not work, and that finding out will not work at all. So at that point of time, what do I do? How do I turn that should into a could? I offer them, okay, you can, for 10 minutes, you take a break and stand in the sun or go play outside with your ball. And this is a very direct statement. And then when you come back, you study one page and answer one question. And this is again a very direct command. Okay, this is you taking over control and telling them. For 10 minutes, you go outside, take a break, play with your ball, come back and study one page and answer one question. Okay. The other thing that you can do when you offer choices, turning shoulds into could is, okay, so you can study one page, answer one question right now, or you can study 3 pages and answer 3 questions at 5 o'clock. Again, this is also direct, but you have choices into what you should do right now or what you could do right now. Okay. Yes, you could go for some activity or a break and get back to studying. Yes, absolutely, you can do that. But please tell them how longer is the break, what activity they can do, and when they have to get back to studying. Okay. At time when you cannot afford to go into wise. If you can afford to go into wise, please always ask them, what is it that they're thinking? Don't ask the why statement. Ask them, what is it that they're thinking? Okay, next question. Which one of the following is considered a type of cognitive distortion? Catastrophizing, leveling, thinking, reminiscing. Oh, everybody's at one. Fantastic. Are we clear with the concept of cognitive distortions? So thinking about cognitive distortion is like diagnosing where the thoughts are going wrong. And once we have diagnosed where the thoughts are going wrong is when we can take an action. So always have that chart of cognitive distortion in front of you whenever you're treating a client. But before that, ask them, what are their thoughts? Ask them to do that exercise. Close their eyes for 2 minutes, write down all their thoughts, whatever they're thinking, and then see what is the pattern that is being repeated. And then you find out what cognitive distortion they are in with your chart. Okay. Okay, we have two things. Which of the following is true for both cognitive therapy and cognitive behavior therapy? The client and therapist work as a team. They're both time-limited, specific educational approaches. I believe that problems are a result of cognitive processing. Changing our thoughts can change emotions or behavior. And of course, all of the above. Okay. Looks like nobody has doubts about this. Fantastic. Okay, this we haven't spoken about, but I want to talk about this flight and fight response. So the flight or fight response model of stress was suggested by Walter Cannon. He reasoned that exposure to prolonged stress can cause physiological and emotional problems. What biological system is responsible for the flight or fight model of stress? And in the time that this has been suggested, one more response is added, that is freeze. So imagine yourself on the train tracks at night time and suddenly you see a train approaching you. You're on the tracks. What will you do? Will you run away? Will you want to fight the train and see how strong you are? Or will you freeze? Okay. So I know this is very technical and medical, but this is something that that will be a good to know for all psychologists, so that when you search for treatment methodologies, you will know what system is that you have to work on. Okay, guesses, come on. I guess it's A and C. Okay, cool. Lakshmi Priya says A. Any more guesses? Okay. So we have two nervous systems in our entire body. One is a sympathetic nervous system, and contrary to the word sympathetic, it is not sympathetic to us at all. This is the one that puts us in a flight or a fight mode or a freeze mode. Okay. Parasympathetic, it says, but this is the one that relaxes us. Okay. And endocrine system is the one that is responsible for our hormones. So when our sympathetic nervous system gets activated, it sends signals to our endocrine system to release the stress hormones. And that is when either we freeze or we fly or we fight. Okay, so the answer to this is A and C. And yeah, Niveda, you did it. Absolutely. But this is something, please read about the sympathetic nervous system, because it will help you find out how to relax your client. So you can make an imaginary situation and ask them what their response would be, or ask them what did they do when they were faced with an adverse situation. That will tell you what is exactly their response, stress response, whether they fight or they run away from stress or they freeze in the face of stress. So you will know what nervous system is dominant in them, and then you can treat them either to control their thoughts, to control their emotion, hormones, or relax them. When you relax them, their sympathetic nervous system goes down. Okay, one trick to calm a very stressed sympathetic nervous system is a hug. When a child is very irritated, annoyed, we hug them. What is it that we're trying to do? We are trying to calm a sympathetic nervous system. Okay, so whenever, if you can, hug, not the client, okay, don't hug the client, but your family members or people, your friends who've come to vent, if you find that their sympathetic nervous system is overactive and you can hug them, please do. Because that is something that is inherent to us, that whenever a mother hugs a child, their sympathetic nervous system gets activated. So do that to your kids. hug your kids so that they know what a response feels like as a pathetic nervous system. Okay, any questions about this? Yes, absolutely, Niveda. When they don't want to get touched, please don't enforce your hugs on them. Give them space. Tell them, okay, I am here. I will still be here whenever you're ready. Let me know my hug is ready for you. Okay. CBT looks at why people think and behave the way they do and then provides them with knowledge and choice. See, the key word here is choice. Again, want to change, don't want to change, that is completely the client's responsibility. It is not your responsibility. And this is what your job description should look like. I am a CBT therapist. I see what you're thinking, why you might be thinking that, and why you might be behaving the way that you're behaving. And I can provide you with knowledge and choices to change that. Okay, this is your job description. But who has to change? The client. Your job as a therapist is only to take the horse to the pond. They have to drink the water. Okay? Let's talk about defense mechanisms first. Anybody has an idea about defense mechanisms? A client who has survived using a defense mechanism will possibly feel angry about having continued to use it, not be keen to let go of something that may have saved them. So when I question here, what is a defense mechanism? Okay. So answers have already come up. But what is a defense mechanism? Okay. Just something that they use to safeguard themselves, justifying their action and thought. Something one uses for safety to protect themselves. Okay. Thumb sucking is one. Absolutely. It's a defense mechanism. Escaping whenever there is a conflict. I want to escape it. That's a defense mechanism. Sleeping is another one. So if there's a conflict going on, I just say I'm going to sleep. Client is not opening up. Having guards up is a defense mechanism. Okay. And whenever you identify that a client is having a few defense mechanisms, do not try to break it. First, always be having positive regard for your client, because this is something that has saved them from all kind of situations that they have been, or they might have thought that they might be in a harm. Okay, don't try breaking the defense mechanisms unless you have replaced their thoughts and their behaviors with some mechanisms or some skills that they can use in the face of next adversity. Let the defense mechanism be there. Ask them to tone it down and use this instead. Use a relaxation method instead. Use a breathing method instead. Use an exposure therapy or a laddering instead. But let the defense mechanism be still there. And then, there is a thing called behavior extinction. When we don't use a behavior for a very long time, it starts getting extinct. So when they use their defense mechanism less and less, eventually it will get extinct. Okay. Avoiding situations. Yes, that's another defense mechanism. Okay, I have I'm going to answer this question first before I go to the next one. Are defense and coping mechanisms same? So defense mechanism is again a type of coping mechanism, but they are something that are not very healthy for us. Okay, either for us or for our family or for our relationships or for our jobs, those defense mechanisms are something that are preventing our growth. Defense mechanism is still a coping skill. Okay, For example, I have this client. Oh, eating is a defense mechanism. Stress eating is a defense mechanism. Okay. So I'm going to go to the next one. This is a scenario. Jackie was passed over for a promotion for a colleague with more seniority and greater experience. She's upset because she thinks her boss does not consider her qualified. What would a CBT therapist do to help Jackie? Empathize? Help her generate realistic alternative explanations? Agree with her that her boss deemed her not qualified? Advise her to find a better job elsewhere? What would you do as a CBT therapist? I think this doesn't have one answer. So you're free to choose two. Okay, so everybody, okay, when I said you can choose two, please don't choose two, okay? Choose the best possible one. There is only one. Help her generate realistic alternative explanations. But why are we choosing this one? Why? This is the correct answer. Help her generate realistic alternative explanations. Do not tell her to find a better job elsewhere, because if she goes with the same mindset to a better job, she will still have the same problems. And we do not empathize with the client that they have been unfairly treated. No. Why? Why? What is it that we identify in this? As a therapist, what do you identify in this? She is upset because she thinks her boss does not consider her qualified. Did the boss tell her that she's not qualified? No, she thinks. That is a cognitive distortion. She doesn't have the fact to corroborate the fact that she is not qualified. So she is just projecting it on her boss. So if she goes with that mindset to another job, she will still have that cognitive distortion. So what you have to do as a therapist is address that cognitive distortion. Why does she think that her boss thinks that she's not qualified? And what can be more possible explanations for promotion for a colleague with more seniority and greater experience? That he has more seniority, that he has a greater experience, that I can be promoted too, provided I have some more skills, right? If it doesn't work here, I can go elsewhere. But what I have to do is I have to get more skills. It is not my boss's problem that I was not promoted. It is something that is still in my control. Okay? Any questions on this? You might have a lot of clients, you will have a lot of clients if you're in practice, where they will come to you with these kind of questions about their jobs. Okay, do not jump into the bandwagon telling them that they might be insecure. Okay, no, Niveda, no. We have to find out where the cognitive distortion is stemming from. How does she think that the boss is thinking that she's not qualified? And when you question about their personal life, they will have the same kind of cognitive distortions resonating elsewhere too. And when you go back in the past, you will have roots where she started developing these kind of cognitive distortions. Okay, but don't go into a client's past unless you have taught them skills to handle this problem. So past, please reserve it for the 5th session or the 6th session, not for the 1st or the 2nd sessions. Okay, cool. What techniques would a CBT therapist likely use to help clients identify and recognize their cognitive distortions? Socratic questioning, collaborative empirist approach, having the client generate evidence for and against their beliefs, or, of course, all of the above. What is an empirist? What does the word empirist mean? And do I wait for the answer? Okay, everybody has answered all, which is right. Empirist means that it's based on facts. It's not based on thoughts. So the knowledge, the information is derived from facts rather than thoughts. Okay. Not really based on experience, but what are the facts? For example, if I go back to the earlier session, not based on experience. What are the facts? That the colleague has more seniority and more experience. That is a fact. Okay. If I question Jackie, if I ask her, why do you think your boss did not promote you? She might say that he might not consider me qualified. But what is the fact here? Seniority and greater experience. This is what you as a therapist have to show your client. Okay. So I have this, I found this really amazing question. Compulsive gamblers, they often think money will give them the power and respect they crave. Their desire for power stems from underlying pervasive beliefs often formed in childhood. That, for example, I am unlovable or I am worthless. So when they do the slots and it gives them a lot of money, they equate their worth with the amount of money that they're getting. What are these beliefs called? Automatic thoughts, core beliefs, or unconscious motives, or cognitive distortions. Aparna says core beliefs, and that is right. These are the core beliefs. So when I say a compulsive gambler means a person who keeps on gambling without stopping. Okay, and these kind of gamblers will have in their heart, they believe that gambling gives them control over something. However, that's not true, right? We know that it's not true. But they feel that when they have some technique or some kind of input, the money that they're getting is validating what they're working. So when they are thinking that money is giving me some sense of control, their core belief about themselves will be distorted. It's not a cognitive distortion, it's a core belief. What I think about myself is bad, it's a rotten. Okay, so there as a CBT therapist, you will have to work on core beliefs rather than cognitive distortions. Anybody has any questions about this? Okay, so I'll take you to the last question. Relaxation techniques and deep breathing techniques are used for treating a mental condition. Is this true or false? I am so proud of you guys that you're listening in the session. Okay, so yes, these are not treating mental condition. Anybody who says they are for treating, please don't believe them. They are just for managing what condition that you're in. What is the treatment? Usually a CBT therapist will use what treatment? Anybody writing? Exposure therapy. Yes, Aparna, thank you so much. Exposure therapy, systematic desensitization, laddering, staggering, all these are treatment methodologies to work on the core beliefs or on the cognitive distortions. Okay, relaxation and deep breathing and keep calm and move ahead. They are just managing a mental condition for some point of time. So as a therapist, you will have to see what is the time for. rather than jumping the bandwagon and trying to do the treatment first. What is the client ready for? So this is all what I had today. And in case anybody has anything to talk about, please feel free. And until next time. You can raise your hand or write in the chat. And if no one has anything, meet again next time.
Thank you, Dr. Rati. All the sessions were wonderful. Very good feedback from all of the students, and everyone enjoys your your sessions. Either you take it on Monday or Friday, and people are waiting for you some sessions for marriage counseling also on Wednesdays. So,
Yeah, sure, sir.
Thank you so much.
Thank you for the feedback, everyone. I really enjoy it when you write about it. I just hope all this information helps you in your therapy sessions, and feel free to contact in case you have any doubts.
And those who really enjoyed and learning and utilizing, please send your video feedbacks or at least audio feedback about the CBT sessions. Will be useful for others and us also. Thank you.
Okay, thank you, sir.
Thank you, Dr. Rati. Wonderful work.